and welcome back to the Wound Care Microlearning series for nurses. Today we're talking about one of the most important distinctions in wound care: acute versus chronic wounds. Understanding the difference helps you set realistic expectations, create the right plan, and explain healing challenges to patients and families. What is an acute wound? An acute wound is a new injury that heals in a predictable and timely manner, usually within 2 to 4 weeks. These include surgical incisions, traumatic injuries like cuts, burns, or abrasions, and minor lacerations. In an acute wound, the body moves smoothly through the 4 phases of healing: homeostasis, inflammation, proliferation, and maturation, without interruption. Your nursing focus is on supporting the body's natural healing process using best practices, protecting the wound, preventing infection, keeping the wound clean, and selecting appropriate dressings to maintain an optimal healing environment. What is a chronic wound? A chronic wound is a wound that fails to heal within the expected time frame, typically more than 4 to 6 weeks, or becomes stuck in one of the phases of healing. Usually this is inflammation phase. These wounds often occur because of an underlying factor, like poor blood circulation as seen in arterial or venous disease, diabetes, repeated pressure or trauma, infection or biofilms, or malnutrition or systematic illness. Chronic wounds are more than just slow healers. They represent a breakdown in the body's repair system. Our nursing role is to identify and correct the underlying cause, not just treat the wound surface, using moist wound healing principles, keeping the wound bed protected and hydrated, and removing barriers like necrotic tissue or biofilms are the key steps to restarting the healing process. Key differences: acute versus chronic. So let's compare them side by side. Let's look at the acute wound first. The timeline: so it heals within 2 to 4 weeks. The healing process is predictable and continuous. Causes are trauma, surgery, burns. The tissue appears to be clean with minimal slough, and the nursing focus is to protect and support natural healing. Now let's look at the chronic wound. So this persists longer than 4 to 6 weeks. The healing process is stalled or interrupted. The cause is an underlying disease, pressure, or poor perfusion. There's necrotic tissue, biofilm, or rolled edges. And your nursing focus is on correcting the underlying cause, debridement, and managing infection. Now let's look at some clinical examples. First up, we have an acute wound. So this is a post-op abdominal incision that's healing on schedule using clean technique and proper dressing selection. Then we have a chronic wound. So this is a venous leg ulcer that has been present for months with heavy drainage and slough. It needs a moisture balancing dressing and to correct the underlying cause. Then we have another chronic wound. So this is a diabetic foot ulcer that doesn't close due to neuropathy and poor blood flow. It requires debridement, offloading, and moist healing support. By recognizing these differences early, you can choose interventions that actually match the wound's needs. Remember, we always want to look at the patient as a whole and not just the hole in the patient. So to recap, acute wounds heal on time, support the body's natural healing processes with best practice, proper dressing, and infection prevention. Chronic wounds are delayed. Identify and correct the underlying cause, maintain a moist wound environment for healing, and remove barriers to restart healing. Your nursing assessment determines which path the wound is on, and your plan of care brings it back to healing. In our next microlearning session, we'll explore the time framework, a simple guide to wound bed preparation. Thanks so much for watching. Keep learning, keep assessing, and keep helping your patients heal. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing,
digital resources, informative books, or high quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.